Tracheostomy suctioning at home. Tracheotomy suctioning is something patients typically do twice daily at home. It efficiently clears mucus and other secretions from the airway and the tracheotomy tube itself, allowing patients to safely and effectively breathe. It's a relatively easy and painless procedure. Even so, tracheotomy suctioning occasionally falls to critical care nurses, EMS professionals, and other providers who may not routinely perform this simple procedure. If you need to suction a patient, whether in an emergency or as part of daily care, here are the basics. Keeping the trach free of secretions is very important. However, mucus is a normal part of every person's airway. It helps protect the respiratory system by filtering out dust, dirt and some germs which are inhaled with the air we breathe. Sometimes we have more mucus than usual, such as when we have a cold. The tracheostomized child cannot close off their airway to create enough pressure when coughing to remove secretions. By inserting a small catheter into the trach tube, mucus is removed and the child can breathe more easily. Effective suctioning can decrease the possibility of upper airway infections, pneumonia and a possible oxygen requirement. At first, your child may pull away or cry when you try to suction. Suctioning is a little uncomfortable because it causes coughing, but it should not hurt your child. Try to remember that you are helping your child to breathe easier when you suction. Also think about what you are doing, rather than how your child is acting when you suction. Indications for suctioning. Twice daily suctioning reduces the risk of accumulated secretions that lead to inadequate ventilation. In so doing, it can prevent several complications, including infections, hypoxia, cardiovascular episodes, dangerous intracranial pressure, and lesions in the trachea. Patients should suction the area in the morning and before bed. Other indications for suctioning include a moist cough or rattling sound, inability to clear secretions by clearing the throat or coughing, difficulty breathing, an airway obstruction due to an infection, inflammation, or similar cause, seeing mucus in the opening of the trach tube or hearing mucus in the airway, increased respiratory rate or effort, retractions, which is seen when the skin between the ribs pulls in while breathing, nasal flaring, which is seen when the nostril flares out when your child breathes in, change in skin color from normal to pale or blue, changes in activity, such as if your child is upset or inconsolable, or appears to be sleepy, increased coughing, supplies needed for suctioning, self-inflating bag, if your child is on oxygen or on a ventilator, normal saline, sterile suction catheter kit, suction source, oxygen, if required, a fully charged suctioning machine with fresh tubing and catheters, hydrogen peroxide, distilled water, gloves, non-latex, white vinegar, 4 or 6 ounce paper cups, cotton swabs, suctioning procedure with machine. The suctioning procedure is relatively simple. After gathering the necessary supplies, do the following. Place the patient in a comfortable, stable position with the neck and head fully supported. Wash hands and arms with water and soap. Fill a paper cup with distilled water. Put on gloves. Most providers glove only the dominant hand for easier access, but remember not to touch the patient or any equipment that touches the patient with your ungloved hand. Check cuffed tracheotomy tubes to ensure the tube is appropriately inflated. Open the suction catheter package and connect the hard plastic end to the connecting tubing. When not using the catheter, wrap it around your gloved hand to prevent contamination. Turn on the machine and expose the tracheotomy opening. Without applying suction, finger off of the suction vent, insert the catheter about 6 inches into the tracheotomy opening, or until you detect resistance. Begin suctioning by covering the suction vent. Remove the catheter, then rotate it with a slow and even motion. Apply suction as you withdraw. Avoid suctioning for longer than 10 seconds. Between each removal and insertion, clean the catheter by inserting it into the small cup and using the suction vent to pull up small quantities of distilled water. Give the patient 20 to 30 seconds of rest between each suction pass. Monitor the patient for any signs of distress during the suctioning process. After suctioning, fill a basin with distilled water. Flush the water through the catheter and tubing, then turn off the machine. Place the catheter back into the package. Then rinse the catheter and store it along with the other supplies to be disinfected with the hydrogen peroxide. Remove your glove and wash your hand.